So I think independent practices have a great opportunity to use those clinical pathways in a way to create efficiencies within the practice in order to better manage complex chemotherapy regimens, as well as to manage much of the symptoms and the complex symptoms associated with cancer patients actively on therapy. I think a lot of practices have not implemented pathways yet, partly because just lack of education exposure. I think some practices feel that they got their own methodologies in place just by doing it on their own. And then sometimes there's the cost of a pathway system that comes into play. As far as QCCA goes, as a group and through group purchasing, we've been able to create what I think are financially advantageous opportunities to be able to run clinical pathways within independent practice groups. Clinical pathways is a core element, in my opinion, on being able to provide value-based care. And that's one of the major objectives of QCCA as a network of strong independent practices in order to optimize value-based delivery of care. So QCCA feels strongly that the implementation of clinical pathways and symptom management pathways is part of the stuff that we need in order to achieve value-based delivery of care.